You know, before any big surgery, there's a whole checklist of tests you have to go through. But for a teenager, there's one question that can be way more complicated than any blood test. Is there any chance you could be pregnant? Today, we're going to dive into this really critical dilemma, the delicate balance between safety, privacy, and a young person's right to choose when it comes to medicine. So here's how we're going to break it all down. We'll kick things off with the medical risks, why this is such a big deal in the first place. Then, we'll get into the unique challenges that come up with adolescence. After that, we'll tackle the big ethical debate, unpack the legal side of things, and finally, look at the smart, balanced solution experts have come up with. Okay, so let's jump right in. To really get this, we have to start with why this question is so important from a medical point of view. You see, this is not just some box-ticking exercise. The stakes are incredibly high for everyone involved. Just look at this number. Between 2003 and 2009, there were 42 separate reports in the UK where a patient's pregnancy was completely missed before a procedure. Think about that for a second. 42 times this critical piece of information just fell through the cracks. And these are not just statistics on a page. These are real people with devastating outcomes. In 3 of those 42 cases, the result was a spontaneous abortion. In another 12, it actually led to legal action. So this isn't some theoretical what-if scenario. It has profound real-world consequences. So what are we actually talking about here? Well, things like anesthesia, surgery, and radiation can pose some really serious risks, especially during that first trimester when a pregnancy is at its most vulnerable. Exposure can lead to a higher risk of miscarriage, birth defects, or developmental issues from certain drugs. And it's not just about the fetus. There are increased health risks for the mother, too, which makes this an absolutely crucial safety check. Okay, so now we know why we have to ask, but this is where things get really complicated. Because when the patient is an adolescent, what seems like a simple, straightforward question suddenly becomes a minefield. And you might be thinking, well, is this really a common problem? The answer is yes. Even though teenage conception rates have been falling, the UK's are still the highest in Western Europe. This data from a few years back shows that this is a scenario that doctors and nurses face all the time. It's a very practical, recurring challenge. So why not just ask? Simple, right? Well, not so much. I mean, picture this. You're a teenager, you're about to have surgery, and maybe your parents are sitting right there next to you. You might be terrified of them finding out, or even worried about getting into legal trouble. On top of that, biology makes it tricky. Teenagers often have erratic cycles, and some, believe it or not, just genuinely don't know they're pregnant. All of this makes asking for a simple yes or no a really unreliable way to get the truth. And this brings us right to the heart of the issue, this ethical tightrope that healthcare professionals have to walk every single day. It's the duty to protect a patient from harm versus a young person's fundamental right to privacy and to make decisions about their own body. And this is where the debate gets really interesting. You've got 2 very powerful arguments clashing. On one hand, making testing routine protects everyone and standardizes care. But on the other hand, it can feel like a huge intrusion of privacy, potentially damage the trust between a doctor and patient, and even cause unnecessary stress from false positives. Both sides have incredibly valid points. And this quote right here, it really just nails that central tension. Even a safety measure that's put in place with the absolute best of intentions can feel like a violation of a person's rights. It's such a powerful reminder that healthcare is about so much more than just clinical outcomes. It's about respecting the individual. So what's the solution? How do you possibly navigate this? Well, to even begin to untangle this, we have to look at the law. Because when it comes to a young person making their own medical decisions, age isn't the only thing that matters. The key concept we need to wrap our heads around is something called Gillick competency. It's a legal idea that basically says a young person under 16 can consent to their own treatment if they're mature enough to fully understand what it all means. So capacity is about understanding, not just a date on a birth certificate. And this isn't just some vague, abstract idea. It's actually a pretty clear checklist that clinicians use. Can the young person understand the information they're being given? Can they remember it long enough to weigh their options? Can they use it all to make a choice and then tell someone what that choice is? If the answer is yes to all of these, then they're considered competent to decide for themselves. And just when you think you've got it figured out, it gets even more complicated depending on where you are. Get this. In England and Wales, if a competent young person says no to treatment, a parent or a court can actually overrule them. But in Scotland, that same no cannot be overruled by a parent. That's a huge difference, right? And it adds this whole other layer of complexity to the decision. Okay, so with all this medical risk, ethical debate, and legal complexity, how on earth do doctors and nurses handle this in a busy hospital day in and day out? Well, thankfully, they're not just winging it. They turn to evidence-based guidelines. The Royal College of Pediatrics and Child Health has developed this really comprehensive framework that tries to find that perfect balance between keeping patients safe and respecting their rights. And the key principles just make so much sense. It's all about giving clear information ahead of time, guaranteeing confidentiality, and making sure there's a chance to talk without parents in the room. Crucially, it pushes for a tailored, risk-based approach, not a mandatory one-size-fits-all rule. It's a roadmap that respects the adolescent while still putting safety first. And here's what that looks like in the real world. For a really high-risk surgery, something like a major operation for scoliosis, a pregnancy test is probably the right call. But for a much lower-risk procedure, a sensitive and private conversation might be all that's needed. It's all about using thoughtful professional judgment for each individual case. So, what's the big takeaway for you in all of this? Well, the most important thing to know is that there are these really thoughtful, expert-designed systems in place to handle this incredibly sensitive issue. It's a structured approach that makes sure these decisions are made carefully, protecting both a young person's health and their rights. And, at the end of the day, this whole conversation really boils down to one massive fundamental question in medicine. Where does the duty to protect end and the right to privacy begin? There are no easy answers, just a constant, ongoing effort to find the most ethical and compassionate balance. And just so you know, our deep dive today was built on the fantastic research and guidelines from these key articles. Thanks so much for joining me.